Have you ever felt like you start to fall backward and you can't stop it? It's one of the most common balance issues I see in my patients over 50. Hi, I'm Kathy. I'm a physical therapist, and today I'm going to explain why it happens and show you 5 simple exercises that you can do to fix it. When you lose your balance backward, the muscles in the anterior chain, that means your abs, your hip flexors, and your ankle dorsiflexors, have to kick in quickly to help pull your body forward and keep you from falling backward. As we get older, those muscles can get weaker and a little slower to react, and that can make it harder to catch your balance in time. But I'm going to show you how to retrain those balance reactions with the right exercises. The first one we're going to do is chops and lifts. This is going to retrain those core muscles to get them react a little bit faster. And the nice thing about this is you don't even have to get on the floor. As we lift from one shoulder to the opposite hip, and I'm using a weighted ball today. This one weighs about 8 pounds. That helps those core muscles engage as we add a little bit of rotation as well. So for these, we want to do about 10 on each side. Now let's switch over to get the other side. As you're doing these, you can go ahead and shift your weight from your right foot back to your left foot and just add a little bit of rotation. And you can even use your eyes to follow the ball, and that'll just help kick in the vestibular system just a little bit more. The next exercise is ankle dorsiflexion or toe raises. These help us to activate the muscles in the front of our legs that help pull us forward if we fall backwards. As we fall backwards, our toes lift up and they help pull us forward before we lose our balance too far back. If you're doing these at home, you'll want to do between 10 and 15. And if lifting your toes is just a little bit too easy for you, you can lean against a wall with your feet forward and lift your toes from there. That'll make it a bit harder for you. The next exercise is limits of stability using the foam. You'll rock forward and back, shifting your weight from your heels back into your toes as far as you can without falling over. You'll want to do this near a chair just in case you fall backwards a little bit too much. It's also good to have a counter right nearby to keep you safe. Another exercise that you can do with the foam is stepping up and back down off of the foam, and this helps to give you dynamic control. When you're doing these, you'll want to step forward about 10 times with the left foot, followed by about 10 times with the right foot. As we're doing these, we want to engage those core muscles by drawing the belly button into the spine. What this does is it helps activate the transverse abdominal muscle that acts as a corset to help keep you stable. And the last exercise is retro walking near the counter. As we take small steps backwards, or bigger ones if you're able to, the muscles in the front activate to keep you from tipping over. It also helps with the ankle dorsiflexion because as you step back, your toes are coming up. And it also works some of those muscles eccentrically. These simple drills help strengthen the muscles in the front of your body and prevent a backward fall if you should lose your balance. If you practice a few minutes a day and stay consistent, you'll notice better balance reactions and more confidence when you walk. Practice these a few minutes a day and you'll notice more stability when you walk and more confidence. If you found this helpful, you'll want to watch my video on 5 low-impact exercises to help keep you strong.